Breast cancer detection in its early stage is possible with the help of dogs. Come on, let's see in detail. This is Soumya's capsules enriched with knowledge. Breast cancer is considered as a major health issue among women. It is the second most common cause of cancer death throughout the world. Early detection is important for more efficient treatment. Currently, mammography is the most commonly used screening test. This test has a reported sensitivity of 77% and a specificity of 91%. Breast cancer can be detected even during the asymptomatic phase and can reduce the mortality rate. But mammography is still having several challenges. Some of them are: mammography is not sufficiently utilized even in developed countries. Non-malignant lesions are also detected, which sometimes lead to unnecessary testing, treatment, and anxiety. And at the same time, mammography is less sensitive in dense breast. Mammography is associated with significant pain due to the relatively strong pressure applied to the breast. Moreover, there is a risk of radiation exposure, especially in younger women with abnormal germline genes. Considering all these drawbacks of this mammography, an alternative test with better compliance is needed to detect breast cancer in an early stage. Cancer detection by dog sniffing has been one of the candidates as a new method to detect breast cancer. A group of scientists from Tokyo, Japan conducted a preliminary study on the feasibility of canine cancer detection of breast cancer using urine sample. There are previous scientific reports stating that trained dogs can successfully discriminate between patients with cancer of skin, bladder, lungs, breast, prostate, ovary, colorectal, liver, uterine, or cervix from the control on the basis of odors of breath, urine, blood, or cell culture media. As a first step, this study was aimed to assess the potential of urine samples for breast cancer screening using a single trained sniffer dog. Dog selected for this study was critical. A 9-year-old female Labrador retriever was selected. The dog has passed the preliminary test, thereby confirming its ability to selectively sniff both the breath and the urine of cancer patients. The researchers trained the dog in such a way so that she was able to distinguish urine samples of breast cancer patients from non-breast malignant patients. Originally, the dog was a water rescue dog, and then, because of her high ability of sniffing out and eagerness, she was recruited to have a cancer detection training. She was trained by a professional trainer for cancer detection. In the first step of training, the dog was trained to detect a breast cancer breath sample. The full course of training consists of about 12 months and 10 days. In the final step, the dog was trained to detect a breast cancer urine sample from 5 samples, which included 4 non-breast malignant disease urine samples. The final steps took 3 days to complete. The dog's correct indication was sitting in front of the target sample. Every time the correct indication is seen, the dog was rewarded and reinforced by simultaneous play with a tennis ball. In this way, the dog was trained to be able to detect breast cancer patients' urine sample. Researchers considered three groups of samples. First one was the patients with primary breast cancer, and the second one patients with non-breast malignant disease. Third one was the healthy volunteers. Patients from two hospitals who were diagnosed with cancer during January 2011 to October 2012 were taken for the study. Patients with breast cancer were confirmed using mammograph and or ultrasound and confirmed pre-operatively by histological examination of core needle biopsy samples. Patients with non-breast malignant disease were also confirmed by biopsy. For female patients, mammography or ultrasound was performed to rule out breast cancer. Healthy volunteers were verified with systemic cancer screening tests including blood test, chest x-ray, abdominal ultrasound, mammograph and gynecological examination. A total of 200 participants were randomly selected in the study, and this included 40 patients with primary breast cancer, 142 patients with non-breast malignancies, and 18 healthy individuals. All participants were female except for one male person in the healthy group. Participants were voluntarily enrolled in this study and provided written informed consent. This study was conducted in accordance with the principles embodied in the Declaration of Helsinki and was approved by the Ethics Committee of the hospital. The urine samples of the participants were collected with a paper cup and transferred to sterile test tubes, and each test tube was sealed with a cap. Urine samples of the breast cancer patients were collected a few days prior to surgery. The test tube samples were then stored at -20 degrees Celsius until 1 ml of the selected sample was used for the dog sniffing test. All the urine samples were collected in the participated two hospitals, and the samples were strictly handled and stored according to the standard protocol. Wooden box equipped with a 10 cm wall inside to hold a urine sample tube were used for sniffing test. Each box was covered with a metal mesh to avoid dogs direct contacting with the test sample. The dog detected the breast cancer samples correctly in all the test runs, and thus the overall sensitivity and specificity were both 100%. Evidences has shown that human body emits a wide array of volatile organic compounds, both odorous and non-odorous, depending on the individual's background. These volatile organic compounds are emitted throughout the body, including breath, blood, and urine. According to the analysis of volatile organic compounds, different volatile patterns have been correlated with a variety of diseases, including cancers, which dogs can be trained to detect. Combining the dog-based study with instrument-based electronic nose research would be a mutually beneficial program for further analysis. The researchers are of the opinion that even though this dog-based diagnostic method is difficult for disseminating in clinical practice, but as a preliminary result, it helps in further research and in developing a new breast cancer screening method based on volatile organic compounds. There are several advantages with canine cancer detection. Dog cancer detection is entirely non-invasive, safe, and easy for both patient and everyone. The sampling and storage requires no special condition, and the sample can be stored up to several months after sampling. It is of a great advantage because it is not always possible to test samples shortly after the sample collection, and this method would have a good prospects, especially in low income countries where common access to mammogram is still an obstacle. Only developed countries can adopt high technological cancer screening. In the low and middle income countries, despite that the effort for cancer screening program have been made, it is difficult to implement technologically advanced approaches. In these countries, the lack of hospital near rural locations, the prohibitive cost of medical care, and insufficient equipment, shortage of medical workers are obstacles to cancer screening. Researchers believe that some well-trained sniffing dogs traveling around medically underserved all over the world would save many lives. A detailed report of this research paper is available in the journal Biology 2021. Thank you for watching, and I'll be coming back with more interesting scientific facts. This is Soumya's capsules enriched with knowledge.